Welcome and thank you for attending our community town hall. We're providing interpretation in Spanish this evening, which I will explain now. If you would like to hear the presentation in Spanish, find the world symbol on your dashboard and select the Spanish language. I am Betsy Hamilton, proud and grateful superintendent of the Lawndale Elementary School District. I'm proud to work in a place with such dedicated professionals and parents who have risen to the challenge of COVID-19 and distance learning. I'm grateful to lead in a district that values collaboration and mutual respect and keeps students at the forefront of our decisions. Our Safe, Clean, Ready plan is a detailed and thorough plan for all of us. And we each have a crucial role to play in ensuring that we all remain healthy and safe. By making sure that we all wear masks, socially distance, wash our hands frequently, and avoid gatherings, we all have a part in protecting our own and each other's health. Our purpose today is to update you on our path to opening schools to provide instruction and services for students, and to share how we are providing a safe and clean environment for students and staff. This town hall will be recorded and can be viewed at a later date. We know that our county is still in the purple tier, which means we have a high level of transmission of the virus. We also know that cases are on the rise. Nevertheless, we will continue to prepare for the safe return of students by following all the requirements of the Department of Public Health. We will continue to survey parents prior to bringing on additional groups of students. And we know that some parents are eager to have their students come to school and others prefer to stay in distance learning. We will do our best to meet your needs. Distance learning has given our families unprecedented access to observing their children's virtual classrooms and seeing our teachers' instruction and interaction with students. As difficult as these past several months have been, I hope that our staff and our parents have learned more about each other's worlds. Today, we will be hearing a report from Dr. Daniel Urrutia, our Safety and Risk Coordinator, on how we are rising to the challenges posed by the coronavirus. He will share our Safe, Clean, Ready plan, and you will have an opportunity to enter questions into the chat. Dr. Urrutia will pause briefly after each section of the presentation to answer questions. Next, you will hear brief reports from our assistant superintendents, Dr. Jansen from Business Services, Dr. Santos from Human Resources, and Mr. Collier from Educational Services. Thank you again for attending, and I'll now turn it over to Dr. Urrutia.
Thank you, Dr. Hamilton, for that introduction. Good evening, everyone, our Lawndale community. Tonight I'll give an overview of our Safe, Clean, Ready plan. And just to give you a little introduction of what the plan entails, it's an intent to translate the Los Angeles County Department of Public Health, California, CDC, et cetera, all that guidance that we receive to ensure a safe and clean environment. We translate that content into actionable words, safe, clean, and ready, to categorize the steps we have or will take in an effort to bring students back. Before we get into the actual plan, I wanted to provide an overview of where we're at. As Dr. Hamilton mentioned, Los Angeles County is and has remained in the purple tier. And to give you an introduction of what that means, California has what's called a blueprint for a safer economy. And it categorizes counties into these colored risk tiers. And so the most widespread tier is the purple tier. And as counties progress and improve the transmission of COVID amongst the county, they are upgraded to the next tier down as substantial for the red tier, orange moderate, the yellowish color is minimal. And so LA County has remained in that purple tier as a result of our case rate. We have high transmission of COVID-19 within LA County. Now, LA County is a very large county. We do a lot of testing. So as a result, we have a fairly high case rate. But because of that case rate, that's what's keeping us in that purple tier. There's a few metrics the state uses for designating the tiers, and another one of those is the positivity rate. And for the positivity rate, we qualify in the orange tier, the tier 3, and our health equity rate is in the red tier. But again, because of that adjusted case rate, which is currently at 13.7 per 100,000, we still have to remain in the purple tier as a county. Recent data as of 11/17, that was yesterday, we had 2,300 new cases and a total of 344,000 plus in Los Angeles County, and 953 current hospitalizations. And those numbers are important because the case rate affects what the future holds in terms of hospitalizations. And as you know, if we get to a point as a county where hospital capacity is diminished, we'll start to see increased restrictions such as safer at home, which you saw probably in the news earlier this week. Zooming in a little bit, again, LA County is a very large county. It's the largest county in the country. We zoom in and kind of look at where we are at as a city of Lawndale in comparison to our neighbors. And so what you see here is the population and then the relativity to the number of cases we've had. And so Lawndale as a city has remained around the middle point of that infectious rate. So we're at about 2.21% of our population for Lawndale, and you can see that's about right in the middle. Zooming in a little further, we look at what Lawndale is considering. And so what we did was translate some of the options that are available to school districts that are in the purple tier in Los Angeles County. And you see where some of the options that we have available. Obviously, distance learning is an option, but we've also planned assessments for students with IEPs and English learners. We've brought back a few cohorts of preschool students. That was October 26th. And then there's additional planning that is ongoing. So that's a list of the options that are available in Los Angeles County for school districts that are in the purple tier. Whenever as a county we move to the red tier, phase 2, you'll see some more guidelines related to what we would plan for in-person learning, more traditional sort of in-person learning. To see the latest status of our reopening phases, you could either scan that QR code, or you could find a link at lawndalesd.net/SCR, which we'll share a little later in this presentation. So again, overview of Safe, Clean, Ready. The goal is to follow the public health interventions that are designed for pandemics. And as we know, those interventions are not perfect by themselves. And so there's multiple layers to it to help mitigate the risk of viral transmission. And so we see things under the safety category, like safe distancing. We have the social distancing policy in LA County and the state, where we want to keep 6 feet distance. We see equipment, PPE has become a part of our language, personal protective equipment. So wearing the masks and gloves and things like that. Safe hygiene, staying home when you're sick, washing your hands frequently, etc. Disinfection, so under the clean category, disinfection, ventilation, and preparing our environment. So we'll take a look at what that means as a school district. And then we'll talk a little bit about what ready means in terms of our planning and our guidance and our communication. So we'll talk a little bit about safe, and then I will pause at the end of this section in case there are any questions throughout. So big category in the safety realm is distancing and equipment. So as mentioned, the 6-foot physical distancing is required, obviously not only throughout our school district, but anywhere we go. So when folks are at the grocery store or Home Depot, you want to try to maintain that 6-foot distancing as much as possible, as it's one of those public health interventions that we all must employ and adhere to to try to reduce virus transmission in LA County. And one thing we did as a school district is ensure there was signage and markings posted as visual cues and reminders. And so if you picked up any meals, food service meals from our school sites, you probably noticed some markings on the floor that are 6 feet apart as folks queue up to pick up those meals. And then congregation, obviously we want to minimize throughout the campus. And so whenever students return, you'll see things like one-way paths and staggered arrival and drop-off. Equipment, again, PPE has become a part of our everyday language. And so as you know, mask face coverings are required anywhere you go. And recently this week, the governor issued new guidance requiring face coverings even when you're out in public, regardless of if you are alone or not. And so anyone entering school property is required to wear a face covering, and that includes our students. Of course, we'll adopt alternative strategies for students that may have toleration issues under their IEP or 504. And then we have protective equipment for staff. It's well stocked and we're well prepared. Our departments at the district have worked hard to prepare our environments to ensure we're ready. So on the right, you'll notice some signage at our school sites. So if you've been, again, for meal pickup, you probably have become familiar with these. The other realm of safe is hygiene and screening. So hygiene, obviously, we all have a role to play. Hand washing is very important and trying to avoid touching your face. And so one thing we focused on was ensuring that we had visual cues above our sinks especially for our littlest students that had instructions on proper hand washing. And that includes scrubbing with soap and water for 20 seconds and then drying with a paper towel. So we place this signage above all of our sinks in the district, so our students will have those visual cues and instructions to assist with proper hand washing. We also have hand sanitizer dispensers throughout the campus, as well as portable hand sanitizer stands that would be placed in strategic locations where proper hand washing via a sink may not be available. Wellness screening is another important area. We all have a role to play. So, school district or going out to the grocery store, if you're sick, stay home, is the messaging from Department of Public Health. And we all want to reduce virus transmission, especially as we approach the winter time when flus and various colds run through our communities. And so we really want to stress stay home if you're sick. When students return to in-person instruction, really must emphasize that it's a dual role before leaving the house to ensure that screening is done. And that includes the check-in concerning a new cough, shortness of breath, fever, or any other symptoms that are of concern. And again, can't stress this enough. If anyone's experiencing symptoms, it's best to stay home until you can roll out the illness and seek medical advice. And the last component of SAFE, to give a high-level overview here, is a little bit on testing and tracing. I'm sure contact tracing has also become a new definition in your pandemic vocabulary. And so just to focus on testing first, we have testing available throughout LA County. LA County has done an excellent job at ensuring there's testing locations widely available. And so you can find local locations via covid19.lacounty.gov/testing. And there are many that are around us. The closest is in our neighboring city of Hawthorne, but they're all very close proximity. And it's fairly easy to make an appointment to get a COVID test. Tracing is another component that we focus in on. And it's essentially done not only by the district, but also Department of Public Health. So anytime Department of Public Health gets a notification that somebody tested positive for COVID-19, they will engage what's called contact tracing in an effort to contain any possible spread. And then they'll ask those individuals that are a close contact to quarantine. And what it means to be a close contact is you have spent 15 or more minutes over a 24-hour period within 6 feet with somebody who was positive. And so it should be a goal of everyone's to avoid becoming a close contact just in case. And so what happens is a contact tracing goes into effect, just focusing on the school district team. Our team includes our designated public health liaison. We have a member from HR, our Human Resources Department, and a registered nurse, as well as the site administrator. So that team goes into action to engage our containment and response and tracing protocols in conjunction with the actions taken by Department of Public Health upon notification of a positive case. So with that, I will pause there and wait for any questions.
Dr. Urrutia, there are no questions at this moment, but they should be coming in anytime soon.
Yes, I'm sorry. The chat has been enabled for questions to come in.
Yeah, if we don't get too many questions, I'm happy to continue on and then include them after the next section.
Yeah, why don't we do that? I think that'd be a good idea.
Yeah, okay, so I'll move through clean here. And so this covers disinfection, ventilation, and how we prepared our classrooms. And so just to clarify a little bit on what cleaning means, I think this is some more definitions in our pandemic dictionary. And so cleaning is the process of removing dirt and impurities from surfaces or objects. Disinfecting is a little different. Disinfecting is the action of killing germs on surfaces or objects, and then sanitizing. Think of hand sanitizer is reducing the number of germs on surfaces or objects. And so our custodial teams have worked really hard to ensure that we have frequent disinfecting happening on all the touch points in commonly shared areas. So touch points in restrooms, in front offices, and then the cleaning happens at the end of the day when students are not present, where we're able to get into the classrooms without impacting our cohort of students for that to happen. So we have a fairly robust cleaning process at the district, and there's a big focus on disinfecting to ensure that all those touch points are frequently disinfected throughout the day, in addition to the cleaning that occurs at the end of the day. A bit on ventilation. This is a big priority for the district. We want to ensure that we have sufficient ventilation within our classrooms. So in addition to moving activities and meals outdoors whenever possible and whenever weather permits, we've prioritized ensuring that our HVAC systems, our heating, ventilation, and air conditioning systems are routinely maintained and are set to maximize the indoor-outdoor air exchange. And what that means is the HVAC units would pull in a high percentage of outdoor air and circulate that air indoors so that fresh air is regularly coming into the classroom. We've also focused on ensuring that all of our filters in our HVAC units are at the highest efficiency possible and change regularly. And then as students occupy a space, we will cycle the air in the room 2 hours before and 2 hours after student occupancy. Again, just to ensure those rooms are well ventilated. Moving along, some photos of what our environment looks like. And so we've made a few changes just to ensure that we have the spacing in our classrooms, as well as the appropriate furniture to allow for frequent disinfecting and cleaning. And so our classroom furniture is set up to ensure the 6 feet spacing that we talked about a little earlier in the distancing section, so that students are spaced out and have again, a well-ventilated, spaced out environment. We've removed soft and porous materials, such as bulky excess furniture that are difficult to clean, so that we have those porous surfaces, which are much more effective at being disinfected. And with that, I will pause and answer any safe and clean questions.
All right. Dr. Urrutia, this may be going out to everyone out there in our panel, but one of the first questions is there any word on what plans are in place after the winter break? What's kind of the timeline, if you know, just to get a good night and an idea out there for our families?
Yeah, I'll defer to the superintendent or cabinet on that question.
I'd be happy to answer that. Thank you. We have been proceeding cautiously to make sure that all of our students and staff are safe as they return to campus. As you may know, many of our staff are on campus and at the district office and will continue to be. We don't have an exact timeline. We have the different groups that Dr. Urrutia was explaining that are possible to bring onto campus during the purple tier. We have an agreement to bring on students in special education and English learner students for assessments. We are also we're very close to bringing students onto campus from our special day classes. And then also we are then looking at small cohorts of students who are special education students and English learners. And then the other group is for the TK2 waiver. It is possible to apply for a TK2 waiver. One thing that is complex, and perhaps some of you know, but many of you may not know, that the waiver process allows for 6 schools, not school districts, but 6 schools per supervisorial area. So we have the Board of Supervisors for the County of Los Angeles. So on a weekly basis, they will look at many applications and they'll approve 6 schools per supervisorial area. And that area is very large. We're in the 2nd supervisorial district. And so we want to make sure that all of our schools could qualify for getting a TK2 waiver. So we are not yet, we have not yet applied for the waiver. It's a fairly straightforward process and we intend to do so. And once we have these other students on campus, as I said, we're proceeding gradually to make sure that every student that comes onto campus is safe and healthy. Yes, so we don't have an exact date, but those other groups are going first and then we will apply for the TK2 waiver.
Let's do a safe, clean, and ready question. Dr. Urrutia, how many times are common areas to be cleaned, like the restroom, throughout the day? What ballpark is the cleaning schedule?
Yeah, that's a good question. So in the Safe, Clean, Ready guide, you'll see some probably more details than you would ever want to know that kind of explain the cleaning process a little more. But just to give a generalized number for that question, restrooms and common areas are slated to be disinfected 3 times per day. And of course, it would be done more frequently based on need and utilization of the restroom.
A quick question regarding masks. Will students be given masks or help with wearing masks once students are allowed to return to campus?
Yeah, so for the most part, I think everyone in LA County probably has a cloth face covering. And there's ways you can make your own cloth face covering. But we'd certainly assist in any areas that we can, especially and honestly, our success story is probably preschool. And I don't know if Mr. Collier would want to chime in on that or a little later on how the preschoolers are doing. But from what I've heard, they've been very successful in needing little assistance with keeping their mask on. And for the most part, it sounds like they are doing very well with keeping their mask on and are enjoying the opportunity to return to school. So, but just to answer his question in short, yes, we would support it any way we can.
Let's talk a little bit about those classrooms. How are classrooms going to be set up so there's plenty of ventilation or even space for that matter?
Yeah, so I'll touch on the ventilation portion. So there's a few methods we can employ, and I'll be remiss, I don't think I touched on this. thanks to our Measure L funds, the bond dollars that passed in the city, we're able to replace any of our old HVAC units, which allow for the higher filter efficiency. And so I'm sure Dr. Jansen will touch on that a little more later, but thanks to Measure L, we're able to get those units replaced and have the higher MERV 13 filter in those rooms. And so what happens is HVAC units do a number of things. They're not just air conditioning, they're not just heating, they're also, they also circulate the air. And so via circulating fans, they would continue to run in the room, continue to pull that fresh outdoor air into the room and circulate the indoor air on an average of at least 9 to 10 times, in some cases more than that. And so that circulation in the air greatly helps. Another thing we could deploy is opening windows and doors, and things like that. So we have a pretty good ventilation plan, and our maintenance team, our district electricians have worked hard to ensure that we're able to do that.
You know what, this question can probably go to Dr. Jansen as well, or yourself. You know, what is the possibility of outdoor classes? Is that an option about outdoors? I know there has to be something outside. What do you think about that?
Yeah, I'll touch on that. A lot of our schools have fantastic green space where we could utilize our outdoor spaces more. So that's something that's definitely going to be encouraged. Of course, it's weather permitting. We're heading into winter, so next few months will probably be a little cold, but we will certainly encourage use of outdoor space as much as possible.
And last but not least, probably for Mr. Collier, will kids still be on distance learning unless otherwise notified?
Great question. One of the things that Dr. Hamilton mentioned, we would do a survey of parents to get their interest of students coming on campus if they're staying in distance learning. So parents, students will have the option of staying in distance learning. So yes, if we brought in a certain set of students and those who elected to be on campus will be allowed to come on campus, and if you wanted to stay at home, you would have the option of staying at home for distance learning. Obviously, as the different phases permits, we cannot bring any certain students on campus right now, grades 3 through 5, and then obviously TK through 2 until the waivers would be approved. So you would definitely have that option.
Okay. Well, at that time, I think we can continue on, Dr. Urrutia, if you want to continue, please.
All right, fantastic questions. Thank you, Dr. Santos. So we'll talk a little bit about READY. And so some of the action items we've taken for planning include prioritizing 5 key concepts. That's staff and student safety, physical distancing, infection control, communication, and equitable access. So throughout all of our plans, we've prioritized these areas, and any in-person, before we bring anyone in person, any of those activities go through extensive review from all of our departments. We each have our own lens, safety and risk from myself, our maintenance department, food services, human resources, et cetera, and really prioritizing, again, those 5 key areas to ensure that we've thought of everything. A little more on guidance, what Safe, Clean, Ready is comprised of. I mentioned earlier, it's a translation of all the different guidance sources that we have. So Los Angeles County Department of Public Health, California Department of Public Health, OSHA is the Occupational Safety and Health Administration, and then the Centers for Disease Control and Prevention. So that really feeds the Safe, Clean, Ready plan. And just to touch on what LA County versus these other guidance sources, LA County is a statutory authority over all public health in Los Angeles. And so we must first follow them. They can be more restrictive than the state. The state is the California Department of Public Health and via Governor Newsom. And so the state sets like a minimum. LA County can be more restrict, and in fact is often more strict than you see in other parts of the state, just because Los Angeles County is the largest county in the country. And so when we talk of opening hair salons for in-person services, that's 30,000 plus hair salons versus some of the smaller counties within the state that may have been able to open those things more quickly. And so you see a little more of a staged and cautious approach from LA County. And then the district, we are fortunate to be able to have direct access to Dr. Barbara Ferrer via who's the director of the LA County Department of Public Health. And we're able to participate in a weekly call with the Los Angeles County Office of Education, or LACO, and the LA County Department of Public Health via Dr. Barbara Ferrer. And that's give us a direct access to ask any questions and seek additional guidance or clarity from those sources. That's helped us significantly with shaping our plans. Moving on to the communication platforms that we have, I really encourage anyone to ensure that they follow us on social media at LESD Schools. Check out the LawndaleSD.net/SCR page. And what you'll find there is the full 30+ page Safe, Clean, Ready handbook. I would ask that any of our parents or really anyone in the community that's interested in learning more about our plans for in-person instruction to take a look at that. It's a Wednesday night. It'd be a good opportunity to read some Safe, Clean, Ready. We can't go out, we have curfew, so might be a good opportunity to take a look. We also have an at-a-glance guide that's just a 2-pager, and that's it's in English and Spanish, and that's available as well, just to give you a quick glimpse of the key things that our parents need to know before students return to in-person school. In addition to that, we have a dashboard, and our goal is to remain transparent with any of our COVID cases when we have students in person for learning. And so on that same webpage, LawndaleSD.net/SCR, you'll find a link to the COVID-19 data dashboard. And again, that will outline the cases that we've had for in-person staff and in-person students, as well as some communication protocols that we'd have for notifying close contacts, or how you would notify the district in the event of somebody testing positive. Some photos. This is our preschool program that again returned on October 26th, and you could see they're utilizing that outdoor space. They are more than 6 feet apart. Each student has their own little kind of play area, and those toys that they have are sanitized between students' use. So they're assigned pretty much toys for the week, and then they're disinfected and sanitized before being shared with other students. You can see they have their masks on. My friend on the right there has a Toy Story Woody mask, and it's kind of a fun experience that they're able to come back to school and see their friends, and it's worked out in our preschool program. So just to summarize, Safe, Clean, Ready is an actionable translation of those public health protocols I mentioned. I would encourage anyone to take a look at it. A lot of the questions we receive can be answered within that plan. And I also ask that, or state that the district's doing everything we can to ensure a safe, clean, ready environment for when students return. But it really takes a collective effort, not just the commitment from our staff, but also from our families to help encourage good hygiene, wearing a mask, following the public health guidance, not only while at school, but also within our community to help keep those COVID-19 case counts low, so that we can get to a point where we are past this as a community. With that, Dr. Santos, any last questions before we move on?
Oh yeah, we have a couple questions out there. One question that's come up a couple of times: if the elementary school is open, are teachers and students required to test before going back to school or going to school?
Yeah, so that's what's called surveillance testing. And right now, public health is not requiring surveillance testing. We follow the diagnostic testing approach. So emphasis on the wellness screenings and getting a test when it's diagnostically necessary. Some things to consider is testing capacity is a concern. We're also looking closely, as a county, as a state, the availability of rapid testing, because that would be far more effective, because everyone in the county would be able to take a rapid test, hypothetically, and know before the day starts if they're positive or not. Whereas a surveillance test, excuse me 1 second, a surveillance test would only tell you if you had COVID a few days ago. And so it's, as Dr. Ferrer has said, it's a false sense of security in a sense.
So a follow-up question on classrooms. I know it's in our Safe, Clean, and Ready on our website, but how many students are we looking at in a classroom? What constitutes a small group? Or
That's a fantastic question. So while we're in the purple tier, the California Department of Public Health requires that any students that return for in-person services requires that a cohort be established. It's a stable cohort of the same group of students with the same supervising adults. And it's currently capped at, for the state, it's at 14 students, 2 adults, total of 16 in a cohort. But remember I said LA County's a little more restrictive. Currently, LA County caps that at 12 students and 2 adults for a total cohort size of 14. And so for the time being, that's what we're looking at now. Of course, that would change if we make it to the red tier. The cohorting requirement is no longer a thing. It's no longer required once in the red tier. But while we're in the purple tier, the cohorting is required. In LA County, it's capped at 12 students, 2 adults. But they could also adjust that to the higher state threshold as a county in Los Angeles County. But as of now, that's the limit.
You know, I have a question out there, and maybe Mr. Colliard or yourself can answer this one. If I have a student that's, a student with special needs, what are the safety protocols put in place for my student, considering that, they could be injured or hurt, or the likelihood of just being in that situation? Have we analyzed, or maybe Dr. Jansen can talk about this too, have we analyzed just the impact of bringing students back and the risks? I mean, have we really considered this option?
Yeah, Mr. Collier, would you like to touch on the special education considerations?
Sure, I can talk about some generalities, because that's a very broad question, and there's a lot of different areas and scenarios that we do go through. So with determining our SDC cohort students who are coming back, so there's been discussions with the parents, considering what are the cautions to take in order to come back to school. And then the teachers have met several times to discuss scenarios on bringing students into class, instructing students, how to put together a safety plan if we have students who may elope, which we call they run out of the classroom and they have a period of time where they may need a break. And also students who may have difficulties wearing masks, and what might be alternatives that they can wear in order to cover up and may have different breaks. So we do consider as many scenarios as possible with the teachers, and that those discussions with the parents are continuously. And also, it also now becomes a part of the IEP goals and specifics that we want to put in place for behavior management.
And we talked about safety measures. Tell me a little bit about the safety measures, considering that the holidays are coming up. I believe we have Thanksgiving next week and then the winter break. Some of our families, I'm considering leaving the country for the weekend. What does that look like? What does that look like for me as a traveler?
Yeah, I could speak generally about what we've seen this week. And so California released recommendations to Californians that are planning travel. And the recommendation is upon return to California, regardless of if you're a resident or visiting, upon return, quarantine for 14 days. And LA County has issued the same guidance to everyone in the county to quarantine for 2 weeks after any travel. So I think it benefits all of us if we adhere to that guidance as people who live in Los Angeles County and in our local community, take that recommendation and stay home as much as possible and limit any non-essential travel.
Last two questions, I promise. So the first one is for you, Dr. Urrutia. Tell me about, we have all these cleaning supplies. Any side effects? Should we know about any side effects of the materials being used? These disinfected products or products that are used for our plan?
I'm glad that was asked. So we've been very diligent with the products that we introduce in our classrooms. We don't have any harsh chemicals. What we have are effective chemicals, and we're very diligent in making sure what we're introducing into our classrooms, because we know these are used by students and adults in spaces that we don't want to flare up maybe folks that are asthmatic or any other sensitivities to these chemicals. So we've not introduced anything that's harsh. We've introduced only, we have chemicals that are effective. And for our disinfectant is the same disinfectant that we've used prior to COVID, and it is effective against COVID. So again, we took a really close look at the products that we have and have not introduced anything that's harsh, just effective. And we made sure it was effective against COVID-19.
You know what? And last question, this might be for Mr. Collier out there. Tell me about this preschool. Are these students interacting or playing with each other? Are they separated? I mean, what's going on there?
Sure. So you can see in the picture, the outdoor spacing that they have their own space. So they're in a class, no more than 12 students. They're in a class, but they have their own personal space. They have their own personal items that they play with. So it's not interaction in terms of being in close proximity. They have to keep their 6 feet distancing and so forth. But I will say, as mentioned before, they're very happy to be on campus. Their parents, the students, they wear their mask. They approach the school campus maintaining the 6 feet distancing. So even though it's not the normal play, they have adjusted and been very happy about their situation for the last, I guess it's 3 weeks now.
We can move forward and I'll be collecting questions. Thank you.
All right. With that, I'd like to introduce our Assistant Superintendent of Business Services, Dr. Gretchen Jansen.
Thank you, Dr. Urrutia. And I just have a brief presentation, one slide. And as I was thinking about everything I was hearing, I really can sum this slide up in gratitude, and particularly appropriate in the season of giving thanks. First, gratitude for the addition of Dr. Urrutia to our team at a very crucial time. Gratitude for our Board of Trustees for approving that new position about 1.5 years ago in hopes of improving school safety, and it certainly ended up being timely. And then in addition, just gratitude to Dr. Urrutia for all of the work that he's done, and how much confidence we have in the plan that's put forth here in Lawndale, which is just top notch. And as I compare the plans across all of the schools throughout the South Bay, we really have one of the top plans, and we really have put student and staff safety as a top priority. In addition, just all of the things that Dr. Urrutia has mentioned come with a price tag. The PPE is expensive, and it gets more expensive as it becomes higher in demand. And I also want to express gratitude to Governor Newsom and to those that represent us in Sacramento for taking the CARES Act funding that was allocated to California and providing a big chunk of those dollars to K-12 schools in California, so that we're able to purchase all of those things that Dr. Urrutia was mentioning: the PPE for staff, for students, the cleaning equipment. All of those items we really would struggle to have purchased without the CARES Act funding. And additionally, all the devices that we've been able to provide for our students to be able to have a robust distance learning program. We really appreciate. Oftentimes we complain about Sacramento and what they've given to K-12 schools, but this is actually an opportunity to be grateful for their forethought in providing all those dollars to us. And then in addition, the last box there related to LESD bond dollars, Dr. Urrutia touched on that, but it's important to again thank our community for approving Measure L back in 2016, and then most recently approving Measure EE that will allow us to invest in new HVAC units in all of our schools. We already have 3 schools that are complete. 2 schools that are underway. And by the end of the summer, all of our schools will have brand new HVAC units, which is uncommon here in the South Bay. Many districts still don't have HVAC units. Many districts have units that are 15, 20 years old and cannot accommodate the MERV 13 filters that Dr. Urrutia mentioned, which we'll be able to use to help ensure that the air in our classrooms is clean. So, just a great appreciation for the resources that we have and that we've been able to put in place for our students and staff to keep safety as a top priority.
So Dr. Jansen?
But yeah, Dr. Santos, if there are any questions, I'd be happy to take them.
Yes, actually, I was about to interrupt you. I apologize for that. So Dr. Jansen or Dr. Hamilton, maybe you can answer this. Both of you are really working, you in charge so much of the maintenance or helping with the maintenance and operation and the budgeting. What's the protocol for, we understand the social distancing, but by staff, is there, what is the phases that we're going to go through if we do come back? What would that look like, or how would that look like, if anything?
Is the question related to what are staff protocols for?
Yeah, the first part is the staff protocol. Yes, for just in general, like what's going on with our staff? Are they following the social distancing? Are there specific rules?
Absolutely. We've been very fortunate that we haven't had any outbreaks or transmission, despite the fact that we've had staff that has never left. So schools shut down. But we still have many staff members that have continued working past that March 13th date when many of our students returned home. Our food services team obviously has remained in place to ensure that our families and our community has access to meals. Additionally, our maintenance team, many clerical staff members, our custodians, many of us on this call have all been physically present in the office, and we are to a person adhering to the protocols as required, and understanding how important it is that we adhere to those protocols to keep all of our team members safe and the people that we work with safe. So we've been quite successful with that, and anticipate that our staff members will continue to follow all of those required protocols.
I'd like to add something to that because there have been a few questions related to the protocols. In my opening remarks, I shared that this is really all of our responsibility. We do not have control about whether you travel. We don't have control about what stores you may go into or whether you socialize with people outside of your family. All of those things are ill-advised during a pandemic. It's inadvisable to do those things. I'm just going to be very direct about it, because when you do so, you expose yourself to the virus. And if your children come to school, they could unknowingly expose staff members and other children to the virus. So I'm asking for your help with teaching your own children now how to socially distance and how to wear a mask. And I think Dr. Jansen, we do issue 2 masks to each student, a cloth mask. Yeah, that's washable. And we will be doing that. And then we also have disposable masks. The other thing is just, when we do open, we're opening gradually because we want to make sure we don't have COVID cases and that everyone is safe. And our first opening was on October 26th. It's not really easy to predict the date that we will be opening, because we will not open until we have agreements with our employees about those protocols being in place and agreements about that we're just safe, clean, and ready to open. And we work with our classified and certificated, our teaching staff. And then we will, when we do open, whether we open, one question was about hybrid, which is having both distance learning and in-person learning at the same time. And that involves, as Mr. Collier mentioned earlier, among other things, surveying parents to see if they want to bring their students back. Because if we don't have the customers at the school, that determines how many teachers we need to be in-person teaching. And if you have a student who has a pre-existing condition or a developmental disability or other factor that makes you uncomfortable with bringing your student back to school, you can certainly address that in the survey or by speaking to your school principal.
And last question for Dr. Jansen. This one has to do with, funding. I'm worried, there's not enough money. We understand this CARES Act funding, it was sufficient to buy things, or was it, or did we have to take away from any of our textbooks or school supplies, anything like that?
Yeah, that's a great question. And it's a question that was brought up by one of our trustees, Trustee Phillips, when Dr. Urrutia shared this presentation with the Board of Trustees a few weeks ago or 2 weeks ago. And it's a very important question because the answer is that we did not have to take away any dollars from our regular instructional program to provide this, to provide all of this PPE and to provide all of the things that we've been able to put in place. And that's because, again, as I mentioned at the top of this slide, these are additional supplemental dollars that we received. And so we still are able to continue with our typical instructional program and supplement with all of these dollars. So great question.
All right, we will continue to get these questions in. If we can move to the next slide and we will continue. Oh, it's my turn. Human resources. Actually, just in preparation, parents, we are going to be sending something out here after the Thanksgiving break. Well, we're going to ask you a simple question. Are you planning to have your students attend? And these are things that I think we should consider. And being human resources, you're probably asking, well, why are you asking this question? Well, that's important because we need to know how much staff or how many staff members we need to make available for in-person. But also take into consideration that as much as we want to provide you the experience that you're having, online with that teacher that you've been assigned, in some cases that staff member may not be available. Also, we are really going to enforce safety protocols at school. I believe we're going to try to make this as normal or what was pre-March normal as possible. But the reality is safety is important. And it's something that, as was reinforced by Dr. Hamilton earlier, it's that safety pledge. It's knowing the ABCDs of COVID. A, always wear a mask. B, be aware of the symptoms. If your kids if those symptoms are showing up, keep them home. C, cleaning at school is a necessity. So you're going to see cleaning happen all the time. And D, distancing. We are intentionally distancing, but important, we're keeping our cohorts very small. So we're going to ask you in return that you too can do the favor. Now, it's interesting enough is that we're working right now in this coordination stage, meaning that myself and the team, because our staff, they want to know it's safe to return. Interesting enough, you as a parent also want to know it's safe to return. It's like you both are asking for the same thing. And really the only thing that can control that is our behaviors together. So it's kind of a joint agreement. We can clean this place, but it's going to take all of us to really practice safe distancing, really keeping our cohorts small. Next slide. The other things we want you to be aware of are the opportunities that are available for you. We understand that right now times are tough. Whether you like it to, you know this, I was going to say, whether people like to believe it or not, we always should be aware of having these conversations with our parents, but also providing them anxiety support, stress management support, and academic support. Those are two major concerns that you have as a parent. I know I do. One, is my student behind? And two, is my student going to get sick? I'm worried about those two things as a parent every single day. And so it's important that you know these free opportunities that we have. One, we have the after school program, Realizing Amazing Potential RAP, which is absolutely free, zero. Yes, no cost to you. Go online and they can help you provide some of these anxiety support, stress management, calming your student. I know it's one more online thing, but you'll be surprised how your students have this opportunity to talk. And lastly is the student support services, providing, we have social workers that are available to emphasize, some of these best practices. What we need you to do is just kind of have that conversation with your student. Ask the child what would help them feel safer. Emphasize those ABCDs that I said. At this time, I'm open for questions. We do have a few, and I believe, Mr. Collier, these may be directed at you. Tell us a little bit about the hybrid plan. I mean, we're going to have this phasing in of K2, or do you want to wait till after you present?
Go for it. I'll answer the question.
Okay, so the question is, what's the schools or districts' plans for the phase of the K-2 students going back to school? What does this hybrid program look like?
So the hybrid depends on the number of students who are willing to come back. So I'll give you an example. So for our SDC cohorts, our special day class students who are on 4 of our campuses, well, 5, including Kit Carson, when we surveyed the parents, there was approximately 50% who wanted to return to school. So with only 50% wanting to return to school, that means we can have students come to school 4 days a week because they're a small enough group to come 4 or 5 days a week if we do a 5-day week. If it's 100% want to come back, then we'll have to break them down into cohorts because we can only place 12 students in a class at a time. What we're doing is we plan the phases and we know how many students are coming back. Then we can determine when the students will be in distance learning and when students will be in person. So those are some things that we're working out. It could be a student could be in a hybrid where there are days that they're at home and then there are days when they are on campus learning, or it might be a day in which they're on campus part of the day and off campus another part of the day. So there's a lot of things we need to work out, but like Dr. Hamilton was saying, if we know who our customers are and who are coming through the door, and we can set up the system when we can know exactly what the hybrid looks like for our students.
Speaking of customers, Dr. Jansen, this question will probably be for you. Tell me about lunch. I mean, are the students going to be available to have lunch in a building? I mean, what's the situation there?
Yeah, food is always important. And so that's a great question. I think we're all probably getting ready for dinner about this time. Yes, our food services team is working diligently on developing plans around the hybrid learning models that are developed. Some key components will be, of course, students can't wear their masks while they're eating or drinking. And so what we're reading from all the protocols is that it's preferred that students eat outdoors. And we're fortunate that we have typically nice weather, not all the time, but typically nice weather and a lot of outdoor table space and a lot of outdoor tables that can be repurposed and moved around. So our food services team is diligently working on that. Students also cannot eat in any kind of a congregate meal location. So our lunchrooms won't look like they've looked in the past, and students will have to be separated and preferably outdoors. We also may, depending on the length of the day, may offer just grab and go lunch. So if the day ends midday, students may take their meals home to consume them there. But our kudos go out to our food services team, really, who has been one of the hardest working groups of individuals since schools closed, and we really appreciate them for all of their work.
And now I have the honor of introducing our Assistant Superintendent of Educational Services, Mr. Colliard, please.
Good evening, everyone, and thank you for all the wonderful questions and just your presence being here. We deeply appreciate your support and your trust that you have in our teachers, our administrators, supporting staff, and educating your children. And I will say, as a team, we deeply want to provide the best education for your children, and we would like to have them on campus, but obviously we need to be at the highest form of caution and safety in order to bring them on campus. And so what I'm here to tell you is just to reiterate the amount of preparation it takes to bring any set of students onto campus. So when we talked about the different sets of students we're allowed to bring in campus right now under the purple tier, our preschool students are on campus because if you did not know, preschool had always been allowed to be on campus, but we had to be, out of an abundance of caution, we had kept all of our students on campus until we could get all our safety protocols and things answered. And our staff knew it was safe. Our parents knew it was safe. We did orientation for staff and for parents, and we also did kind of virtual walkthroughs for them to understand. So what we have to do is we have to have collaboration between our site administrators and all district departments. So Dr. Urrutia, when he talked about risk management, we have to talk with risk management. We've talked about food services. We have to work with food services. We have to work with HR because we have teachers who are certificated employees, and we have instructional aides and other workers who are classified employees, and they have two different contracts. So we have to work with HR to make sure all the rules are followed, and we're making sure we're keeping those employees safe and feel comfortable about being on campus, as long as the students. So all of our stakeholders, we have to get involved. Surveying our parents. Surveying our parents is kind of a two-pronged thing. We have to ask, like, what's your interest? So we can have an idea of how to plan for bringing students back onto campus. And so we know some people are very cautionary and say, hey, I want to stay in distance learning, and that is perfectly fine. If they want to come onto campus, we'll say, okay, we're putting together a plan based upon your grade, based upon your program, how we can best serve you. And then we'll come back later saying this is our specifics, and then give you kind of a final confirmation from you. Here's the teacher, here's the program, and do you want to attend? One of the things that you don't see if you're not on staff, we have two instructional planning committees. One is for general education, the other one's for special education. And this is a team of teachers and administrators, Director of Teaching and Learning, Letty Varela, and Director of Special Education, Sharon Asman, who lead these groups, and they just really work out the details of what the schedule, what would be the best scenario for teaching the students, how do we teach students who are at home, how do we teach students who are in front of us. And so they work out the different scenarios of schedules and the delivery of instruction. And so one of the things that does for us is allows us to really just get a lot of brain power in the room and work out these details. And it also, builds in buy-in from our staff, because they know a lot of the teacher leaders in the district have been a part of planning the process. And then the staff is preparing classrooms. So you saw in the pictures of how the classrooms are being set up. So we are decluttering, setting classrooms up so the students can be 6 feet apart. So all that preparation, we primarily are looking for inside classrooms. I know there was a question about some outside classrooms. We definitely do know we're heading into winter months, so that is a concern. And then if it's rainy day, to adjust for outside classrooms would be very difficult. But we do have in place the opportunity, if there needs to be some kind of break for students, that we may have an outside time period in which they do go outside. So the staff is preparing classrooms. And so when we do get things set up, so for example, bringing back our special day classes, we're doing training for our instructional assistants. We're doing training for our teachers, and going through the classroom about cleanliness, about safety, about different scenarios that may happen. So there's a lot of training involved. So what that means, it's very difficult to nail down a timeline because we're doing all this preparation. We're listening to Dr. Ferrer and the LA County Department of Public Health as they continually give us information every week, the Thursday call that we're a part of. And then so as we plan for those things, we bring in a set of students kind of one at a time. Our preschoolers, we're starting to do one-on-one assessments for special ed students and English learners. And then we're looking at our SDC cohorts, and then we'll continue to march on to EL cohorts or students who are disengaged, and then looking at the TK through 2 students coming onto campus. So as we plan these different phases, once we get to the point where we're ready to go, we have the plan in place, we will share the final plans with the parents and say, here's the plan, here's the teacher, here's the setup. We'll share a virtual kind of walkthrough and ask, okay, on this date, are you ready to join with us? And so, my biggest regret is that when kids come on campus, I can't be a part of the cohort and see their happy faces, but I would be delighted when we get to each phase and we can bring students onto campus. But
so one more answer,
Mr. It takes a lot of planning and a lot of across the district departments. And I will say, if you have a question, obviously, I'm free, but Your school site administrator is your best resource because they are working with us and collaborate with us constantly, and they're setting up their personal schools and specific schools, and they can give you probably the best and quickest answer. But obviously, we're all here for you.
So a quick question out there, and any of you can answer this question. I'm a parent and I have an option, or will I have an option not to send my children to school if I don't agree with the safety plan?
No, absolutely. If someone feels that it's best for their child to stay at home, we'll continue to provide distance learning.
Okay, so speaking of distance learning, I have a question. I mean, are we really, I have a parent ask, since it looks like we're going to be in a, not in-person schooling for a little bit, are we assessing, or how are we assessing our distance learning? What's going on right now in terms of really, working with our distance learning, since it looks like that's the direction we're going to go?
Sure. I mean, there's assessments on many levels. So that on the macro level, we do have tests that we provide in ELA and math for our students to see where they are at this period of time compared to last year. We also have what we call formative assessments, in which we ask teachers to consistently do some kind of we call it exit tickets, or some kind of brief assessment to see where students are in their learning. And our teachers consistently meet at grade levels. They meet as a staff, and they meet in PD with our very outstanding teacher leaders to discuss assessments and where students are in the student engagement, and how we can adjust our teaching strategies to keep students engaged and keep students to be productive. I will say one of our difficult things is we're doing a great job of getting kids logged in during the synchronous time and on Zoom. The difficult thing has become getting students to stay engaged and to complete their work in the afternoon when they are, most likely on their own. So, and that's a problem in brick and mortar too, because sometimes students don't have the best habits, especially if there's not an adult in front of them. But we continue.
Hamilton, if I can interrupt you, Mr. Collier. Dr. Hamilton, we're hearing about school and school starting. When are we going to be notified, the parents, and will school ever go back to the way it was?
Well, I know that if I were in your shoes as a parent, I would want to know a date. But I think that everyone knows that this situation is very dynamic. As we were preparing to apply for the K-2 waiver, we saw day by day the case rates going up in Los Angeles County. And while there was a time when we thought we were moving into the red tier, which would be wonderful, we are solidly in the purple tier, and it's worsening. And so it's very difficult. It would be disingenuous, and it would be inappropriate for me to predict a date. And it would be very disappointing if I shared a date and then that date turned out not to be possible. What I can tell you is that we do very thorough, detailed planning. And one of the stages, as Mr. Collier explained, is we survey the parents. Right now in the purple tier, the only other group that we have not made significant progress on preparation is, in terms of parents, is the K-2 waiver, because we have not submitted the waiver yet. Several questions came in about that. So once we submit those waivers, then we'll wait to hear. And as I mentioned earlier, it may be that we're given the opportunity to open 2 campuses or 3 or 1. That's how the system works. It's not up to us. It's up to the Board of Supervisors, the LA County Board of Supervisors. So when you receive a survey asking you whether you would like your student to come back or not, that will let you know that we are in the active stage of planning for their return. We will let you know when we have a date. We will let you know when we have a date. And it's going to be, it appears at this moment that it will be some time before we are fully back in school. Many people with whom we speak We have 80 superintendents on a call weekly with Dr. Barbara Ferrer, as Dr. Urrutia was explaining earlier. And many are considering the possibility that distance learning will occur throughout the entire year. The thing that determines all of this is the progression of the virus. So I'd like to reiterate one point. Please do not leave it up to teachers to teach your students how to wear a mask and how to socially distance. We want our teachers to be able to focus on instruction, and it would help us so much if you could teach your children about that and the importance of it before they come on campus. And we will do our utmost to move as quickly as we can to bring students back on campus, but only when we're able to do so safely.
Right. You know, we're over our time, and I want to be respectful of everyone else's time. But Dr. Hamilton, any final thoughts? Or actually, should we go around, or would you like me to continue to get some of these questions answered?
No, please go ahead. We have our interpreters here until about 7:25.
All right. Well, then let's go at it. We will go. Will times be increased for distance learning? Are we looking at increasing or making some changes to our current schedules? You know, considering if we're not going to go in person, let's say, or we're not going to be hybrid, are we expecting changes as families out there?
That's a great question. There is, as we continue to evaluate the synchronous versus asynchronous time, you know, from what we can gather, the synchronous time is not necessarily the time that we're concerned about. It's the asynchronous. And so, how can we support students who are not staying engaged throughout the day? Maybe that's through small groups. Maybe that's through tutoring. But we will, you know, it's once we kind of have the schedule set, it's a little bit difficult to change the schedule, but we can see how we can better meet the needs of students through individual and small group instruction.
Okay. Speaking of instruction, I know, you know, it's getting cold out or it's going to be getting cold outside. How is that going to work with rain and cold? Is it still going to be appropriate to open the windows? Is the air purifier in the classroom going to be useful in that context? You know, I'm sorry, Dr. Urrutia, can you add to that?
Yeah, so again, the HVAC systems do a number of things, right? It's heating, it's ventilation, it's air conditioning. And so I mentioned earlier, the fan, the circulating fan continues to run. So it'll pull that fresh air in and cycle the air. And typically the temperature is fairly neutral, regardless of the weather outside. I mean, if it's warm outside, the air is a little warmer. If it's cool outside, it's a little cooler. But those heating elements and the air conditioning elements can still continue regardless of whether the circulating fan's on or not. So that circulating fan will continue to cycle the air to ensure that we have ventilation regardless of the weather. Okay.
You know what? I do see a parent question out there, just a little concerning, but to clarify, can we clarify, or one of you out there, the students who come back will get a different teacher if they return this year? What's that mean exactly?
I'd like to address that. As you know, we plan our school year at the beginning, knowing who's going to come back. The reason we have to survey our families is to find out there may be a parent who's not comfortable having their student come back, or they have an underlying medical condition or whatever, for whatever reason, and they may request distance learning. We need to do that in order to plan. And the issue of whether you get the same teacher is if your current teacher has, let's say, an underlying medical condition or some other legitimate reason why they are not able to come back during the pandemic, then Dr. Santos works with each and every of our over 800 employees to determine whether they are able to come back or not. When we find out whether they're able to not come back or not, and that's through a survey process and an interactive process with all of our employees, then we're able to look and see which teachers are able to come back in person learning, and we may have to reassign some students if that's the case. Because we cannot force a person to work, just like we would not force a student to come to school if they had one of the conditions which would make it unsafe for them to be at work or school.
Speaking of unsafe, I really need this question answered. I mean, I understand the requirement to wear a mask, but if my student has special needs, how are they going to wear a mask for at least 3 to 4 hours, or without removing that? Can you explain how you're going to work with my student?
I think Mr. Collier addressed that as much as possible. And just as when we were back in in-person learning, every student who has special needs can work out arrangements with their classroom teacher and or their special education staff, and through the IEP process, or even informally through conversations, they can identify what are the needs, the particular needs, and strategize how to address that. And I think in the chat, there was also some information about additional protective gear that Mr. Collier put in, about having a face shield and a drape and so on. We will work with all students just as we do when we're in regular in-person schooling.
So we can incorporate some mask wearing practice on school days and really encourage our parents. As I see one of our parents out there, thank you, Mrs. Price. Students will need to kind of work through this and really speak loudly and really reinforce this. So, is that what you're suggesting, is parents help out with this option as well?
Yes, because I think all parents would agree they want us to continue to improve our distance learning program, and when we move to hybrid, we'll need to continue that. And that's what, when Mr. Collier was talking about the instructional planning committees, those are the most robust, detailed committees that I have seen or heard of in my associations with approximately 50 superintendents. And that collaborative process will help ensure that our instructional program is improving. I'm just going to mention quickly, someone asked for an ETA on, or when are the upper grades or middle or high school students going to return? Again, we don't have a date. We don't know. They're not allowed to return during the purple tier unless they had a special need, unless they were part of the cohorts that we mentioned earlier, English learners or special education students, those with the highest level of need.
Yes. It looks like we've gotten through the majority, if not all, of our questions. I know there's some questions out there that are very specific. And would you say we would encourage those individuals to speak with the principal of their sites?
Yes, please.
Okay. Any final words going around the board? I'm going to start with you, Dr. Urrutia. Is there any final thoughts that you have on the topic that we discussed tonight? Any words of wisdom?
Yeah, I would just encourage anyone listening and maybe watching the recording later to take a look at the documents that we have on our website. I think it answers a lot of the questions we see, and again, some of those more detailed questions that you may have, or specific questions, your school site would probably be a good resource. But lawndalesd.net/SCR.
Okay. Mr. Collier, any final words of wisdom regarding the educational services program?
I just want to address, it was one question in the chat that referred to a new research about students with developmental disabilities. So I did look that up, and I will work with our team and send that question to Dr. Ferreira just to get more details. And I'll just say, again, we have a great team that's covering all our bases to make it very safe when your students come on campus. I think we're all parents. Dr. Urrutia, not yet, but we're all parents, and we want the best for your students, and we want to, we're going to get everything we can to make it successful for your students.
Dr. Jansen, please, anything to share? Any words of wisdom, please?
Sure. Well, I don't know if I have any words of wisdom, Dr. Santos. I mentioned earlier that I'm hungry, but what I will share is just again expressing gratitude for the entire Lawndale team. And when I mention our team, parents and community members are certainly part of that team. I just want to underscore, how we've really put student and staff safety as a top priority. And as a parent myself, I certainly understand the hope to get students back to a sense of normalcy and back to in-person learning. but we don't want to rush it. And, just know that every person here cares tremendously about each and every one of the children that we support. And rushing it and bringing kids back too soon and putting them at risk is not something that we're comfortable with doing. And so we're really taking our time and ensuring that when we do come back, we come back safely and in a way that we're all able to continue and move forward together. So just thank you all for participating tonight. It means a lot to see so many of you here. Thank you.
And my final words before I give it up to our superintendent, going back to, we're in this together. So some of these questions out there, can I volunteer? I know you want to be a part of our program and supporting us from outside and really working with our cohorts to keep them small, to help us at home, to really reduce the amount of risk outside would do us a great service. We'd love you to support us, but the reality is we need to keep our numbers small. So I hate to tell you that volunteers are discouraged and not allowed. As for those one-on-one behavioral aids that we need for our class, well, again, we're trying to work with the group. We're going to keep the numbers small. If they're brought to school, we will have their one-on-one, but we're, again, going to keep our classroom small, but we're going to do this safely. As I mentioned earlier, the teachers want the same thing that you want, and the only way that we get this is to do it together and to agree to decide that we're going to do this safely and really change some of our habits. Dr. Hamilton, please leave us with some final thoughts.
Well, my final thoughts are also gratitude to all of you, to our parents. This experience is unprecedented for all of us, unless you were born before 1918 and you have a memory of that. But seriously, we have all of the staff that you're looking at have children, families that they're concerned for and care for. Many of our teachers are teaching your students and monitoring their own students who may be going to a different district and are learning at home. And it's a very challenging situation. I saw Mr. Pena put in a sort of a joke, but it was very funny that maybe the teachers could split their salary with parents because parents are teaching at home. It's been challenging for everyone. And so we appreciate everything that you are doing and will do. And I know I've seen also that there's an interest in having additional town halls. I have learned, and Dr. Urrutia has learned after writing a 30+ page document that's extremely detailed with bazillions of links that people aren't reading. So I think the town hall idea is a good one. And I encourage you to encourage others to attend so they can get questions answered that are important to them. And thank you all very much for attending. And thanks to our interpreters also, and to Marina Sandoval and Enrique Pivaral from our staff to help support this meeting. Have a great night.